This? Right here?
Just start.
I'd like to start with the system we propose to be implemented for treating or walking up mentally ill. First, if a person walking in the street observed to be causing public disturbance or attempting to commit suicide, a family member who witnessed dangerous behavior of a beloved one, he get to apply for emergency detention to the court, and that's called civil commitment. In UK, under Mental Health Act, no patient can be committed. In order to commit the patient, judicial approval is required. The court must hold a hearing. It's a process of 3 stages. The first one, the court must hold a hearing and assign a professional doctor and a psychiatrist to assess the mental health status of the patient. And this assessment can keep the patient up to 72 hours for formal assessment. The court will decide based on this assessment whether or not to detain the patient, whether to discharge him or detain him. They can detain him up to 28 days, for treatment, and the doctor will assess his condition throughout these 28 days, and after it ends, he might think that the patient will benefit from further hospitalization if he still meets the criteria of being mentally ill. And sorry, I'm accepting after you finish. So he can detain him further under Section 3 of Mental Health Act to up to 6 months. If this 6 months ended and he still needs further hospitalization, the process must be repeated all over again by court order. During these periods, the doctors in charge must assess the patient regularly. If they showed any improvement and it's safe to discharge him, or if they are still pose danger to themselves and others, and further treatment is required. Also, through these periods, the patient has the right to be assigned for him a mental health advocate who help him understand his rights and the treatment process. Okay, and the treatment process, and also an SOAD, second opinion doctor, who review the case when he takes treatment against his will. He will review his case and consider if treatment is necessary or not. The patient has also the right to appeal against the doctor's decision to a mental health tribunal, which is an independent body that may that review the case and either discharge the patient or think that further treatment is required. This sort of process to detain a patient, and this whole process we needed to make sure that his rights are preserved, and that he's not detained based on false claims, and to prevent a police state from detaining people based on their political views, or guardians from exploiting their authorities over the patient. Your time is up.
Okay, thank you. I have a question. Okay, you see, with all these medical advancements we're having nowadays, do you think there are any other possible method for follow-up other than locking up?
Well, majority of these patients show limited insight of their state mental condition and of their disease, and they don't even recognize that they are sick at some point. And the doctor will assess their mental health, and if they are competent enough, and if they are not competent, they will not add them to the treatment, and they will need to hospitalize them and institutionalize them to give them the treatment that they need. So we actually have no choice but institutionalizing them.